Hello everyone, welcome to the series on dental anatomy. In today's video, we will discuss about permanent mandibular canine, its nomenclature, function, chronology, dimensions and morphology. So starting with the basic points. The term canine is derived from the Latin word canis meaning dog. These teeth are named canines because their shape closely resembles the conical pointed teeth found in dogs and other members of the canine family. In humans, the canines are four in number, two in the upper arch and two in the lower arch. The upper ones are known as maxillary canines and the lower ones are referred as mandibular canines. These are positioned third from the midline, third from the midline and are present lateral to the lateral incisor and mesial to the first premolar. Their primary function is to hold or tear the food into smaller pieces, that is, hold or tear the food into smaller pieces. They also help in speech, that is, proper articulation of words, maintaining the facial profile or appropriate smile, and guiding the tooth in correct intercuspal position, also referred as canine guidance. Now, coming to the notation system. As per the FDI system of notation, these teeth are represented by the digits 3 3 and 4 3, where 3 3 represents lower left canine and 4 3 represents lower right canine. So if we see in the picture, the lower left canine will be represented using the digits 3 3 and the lower right canine will be denoted as 4 3. In the universal system of notation, we use the numbers 2 2 and 2 7 to represent lower left and lower right canine respectively. In the Sigmondi-Palmer notation system, Sigmonde-Palmer system of notation, we use the symbol 3 3 or 3 3 to represent left and right canines respectively. Now coming to the chronology of the tooth. Permanent mandibular canine erupts at the age of 9 to 10 years. The first evidence of calcification is seen at 4 to 5 months. The crown formation is completed by 6 to 7 years and the root is completed by 12 to 14 years. Next we will look into the dimensions of the tooth. The overall length of permanent mandibular canine is around 27 mm, of which the crown length is 11 mm and the root measures around 16 mm. The mesiodistal diameter of crown is 7 mm at the crest of curvature and 5.5 mm at the cervix. The labiolingual diameter is 7.5 mm at the point of maximum curvature and 7 mm at the cervix. Lastly, the curvature of the cervical line. It is 2.5 mm on the mesial side and 1 mm on the distal side. Now let's understand the surfaces, line angles and point angles. Permanent mandibular canine consists of 5 surfaces, which includes the labial surface facing towards the lips, the lingual surface facing towards the tongue, mesial surface towards the midline, distal surface facing away from the midline, and the incisal surface. In canines, the incisal surface is not a true flat surface as seen in incisors, but rather it is a conventional anatomic term that describes the cutting edge region formed by the cusp tip and the mesial and distal cusp ridges. Also, there is no typical incisal ridge, instead, it represents the mesial and distal ridges of the cusp. Next, the permanent mandibular canine have 6 line angles. These are formed by the junction of two surfaces and derives their name from the combination of the surfaces that join. The line angles include mesiolabial, formed by the mesial and labial surface, distolabial, formed by the distal and labial surface, mesiolingual, formed by the mesial and lingual surface, distolingual, formed by the distal and lingual surface, labio-incisal, formed by the labial and incisal surface, and linguo-incisal, formed by the lingual and incisal surface. Next, the permanent mandibular canine have 4-point angles. These are formed by the junction of three surfaces and derives their name from the combination of the names of surfaces forming them. These include mesio, labio, incisal point angle formed by the mesial, labial and incisal surface, mesio, linguo, incisal point angle formed by the mesial, lingual and incisal surface, disto, labio, incisal point angle formed by the distal, labial and incisal surface, and disto, linguo, incisal point angle formed by the distal, lingual and incisal surface. Now let's study the tooth morphology in detail, starting with the labial aspect. The crown is pentagonal in shape. It appears longer and is narrower mesiodistally when compared to permanent maxillary canine. The difference in mesiodistal dimensions is around 1 mm. The labial surface is smooth and convex, and the labial ridge is less prominent when compared to the permanent maxillary canine. Now coming to the outlines of the crown, the mesial outline is almost straight and is in line with the mesial outline of the root. The mesial contact area or the point of maximum convexity is near the mesio-incisal angle. The distal outline is convex with the point of maximum convexity present cervical to the mesial contact area nearly around the junction of incisal and middle third. The incisal outline is formed by the mesial and distal cusp ridges extending from the mesial contact area and distal contact area to the cusp tip. The cusp ridges are straight and the mesial cusp ridge is smaller than the distal cusp ridge. Similar to the maxillary canine, the cusp tip is on line with the center or long axis of the root. The cervical line is semicircular in outline with the curvature in the apical direction. Now coming to the lingual aspect. The crown appears pentagonal in shape with outlines similar to that seen from the labial aspect. That is, the mesial outline is straight, the distal outline is convex, the incisal outline formed by the mesial cusp ridge and distal cusp ridge are straight, and the cervical outline is curved apically. The lingual surface is smooth, regular, and flatter, similar to the mandibular incisors. It is narrower than labial surface as the crown tapers lingually. The lingual aspect presents important anatomic features such as the cingulum, lingual ridge, mesial and distal lingual fossa, and mesial and distal marginal ridges. The cingulum is smooth and poorly developed. The lingual ridge is raised towards the cusp tip but less developed cervically. As a result, the mesial and distal lingual fossa are also less distinct. The mesial marginal ridge and distal marginal ridge are also less prominent. Now coming to the mesial aspect. Similar to all anterior teeth, the crown presents a triangular shape with the base towards the cervix and apex towards the cusp tip. The mesial surface is smooth and regular, and the cusp tip is centered along the long axis of the root or lingually placed in some cases. This is in contrast to maxillary canines where the cusp tip is positioned labial to the root center. Now coming to the crown outlines. The labial outline is curved, but the curvature is less when compared to permanent maxillary canine. The lingual outline also presents similar curvature to the maxillary canine but differs in degree. It is convex around the cingulum, followed by concavity in the middle third and convexity towards the cusp tip. Compared to maxillary canine, the incisal portion is thinner labiolingually, which makes the cusp appear more pointed and the cusp ridge more slender. The cervical line is curved incisally and the curvature is more than that of maxillary canine. Now coming to the distal aspect. It is similar to the mesial aspect, that is, the crown is triangular in shape. The labial outline is convex. The lingual outline presents convexity across the cingulum, followed by concavity in the middle and convexity in the incisal portion. And the cervical outline is curved in the incisal direction. The only difference between mesial and distal aspects, mesial and distal aspects is the curvature of cervical line. On the distal side, the curvature is 1 mm, while on the mesial side, the curvature of cervical line is around 2.5 mm. Now coming to the incisal aspect. The crown is oval in shape, or we can say it is diamond shaped, similar to the maxillary canine. It is similar to the incisal aspect of permanent maxillary canine. For example, the mesiodistal dimension, which is around 7 mm, is slightly less than the labiolingual dimension, which is around 7.5 mm. The key differences between the incisal aspect of upper and lower canine include: number 1 is the mesial outline. The mesial outline is less curved in mandibular canine as compared to the maxillary canine. The second point of difference is the cingulum, which is smaller and less prominent in mandibular canines. Also, the labial ridge is less developed in mandibular canines. So that was all about permanent mandibular canine. In the next video, we will talk about permanent maxillary first premolar. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe the channel for more such content.